Major support for these broadcasts is provided by New York Community Bank, Chase Commercial Term Lending, Chelsea Lighting, Capital One Bank, Perfect Building Maintenance, Genova Burns, Giantomasi and Webster, Kilroy Architectural Windows, New York's Window Company, the Wyckoff Group, Greenberg Traurig, LLP, M&T Bank. Additional support is provided by Ackman Ziff Real Estate Group, Bank of America Merrill Lynch, Briarwood Organization, Bruce Mosler, C.B. Richard Ellis, Colliers International New York, LLC, Cushman & Wakefield, Dime Savings Bank of Williamsburg, DDG Partners, Friedman LLP, Accountants and Advisors, Flushing Bank, Investors Bank, James D. Kuhn Real Estate Center at Syracuse University, James Orphanides, Centurion Holdings, Madison Realty Capital, Margolin Weiner and Evans, LLP, Certified Public Accountants and Business Advisors, Massey Knackle Realty Services, New Banks, Meridian Capital Group, Newmark Knight Frank, Sterling and Sterling, SJP Properties, Stonehenge Partners, and these friends.
His name is Michael Dowling. He's from Limerick, Ireland. He has a small little job. You know, he runs this little healthcare system with 16 hospitals. And last week we talked a little bit about his life in Ireland and growing up. And we were in the middle of the second term of Mario Cuomo. So let's continue on this afternoon. So now you're working for the governor as his secretary.
Deputy Secretary.
Deputy Secretary. Yes. Let's talk about, because this really, over the period of time, there was Child Plus, there was AIDS epidemic, there's HIV, there's homelessness, because there was a lot of homelessness. I think there was little fights with Mayor Koch I was catching. So let's talk about some of those things.
I consider myself, despite the circumstances of those things that you just mentioned, I was very fortunate to have been there during all of that period of time, which was a fascinating education.
Maybe you used the hurling to fight a little bit also.
Well, you know, there were skirmishes, a lot of them behind the scenes. But it's one thing to disagree and argue and skirmish, as long as at the end of the day you don't make it personal and you respect people's point of view,
but
you move forward.
But which programs do you think that you were so proud of, I mean, over the period of time?
Well, I think there's a number. One was, I think we changed the debate about the responsibility of people who are on public assistance to strive to get a job and go to work, and also emphasize the responsibility of government and others to help them do that and give them the opportunity. I could sympathize with quite a number of people that were in dire circumstances because of my own background, and I never looked upon it as the vast majority of people having a personal failure. I thought that, yes, there are people with personal failures, but there's also opportunities that don't come their way and they're not as lucky as others, and circumstances are bad. So we were actually started a program that got women on welfare to get training and get employment. And we were one of the first in the country to do this way back then.
What about Child Plus?
And Child Health Plus, the first discussions around Child Health Plus was around 88, 89. It finally got into statute a couple of years later. We were talking initially about having a universal coverage program, narrowed down, so we actually got passed a piece of legislation that became Child Health Plus, which today is even still very, very prominent, and was used, by the way, as the model for the National Children's Health Program that everybody has been talking about in the last year or two as part of the healthcare reform debate.
Now, you also were involved with dealing with the insurance companies on health insurance,
Dealing with the insurance companies,
on premium
on
adjustments.
all of that, dealing an awful lot at the time with Empire Blue Cross Blue Shield. Was also dealing at that time an awful lot with the homeless issue. And was
And that's how you met Andrew Cuomo, right? Because
Well,
Andrew was involved with HELP.
Yes, well, Andrew was involved with the administration from the beginning. So I had met Andrew numerous times, but I was very much involved with Andrew when Andrew led the effort to create these programs called HELP to provide supportive housing and employment and support services for the homeless, which still exists and is a very, very prominent national entity today. So yes, I did work very closely with Andrew on this. And I have to say that, working with the governor, with Governor Mario Cuomo, was an exhilarating experience. I mean, I respect him enormously. I enjoyed being with him. He was intellectually challenging like nobody you could ever imagine. But I love that. He was an extraordinarily hard worker, which I liked. But I can also say that, he gave me opportunities, because most of those things that I was given the opportunity to do, I had never before done.
Now, the only thing that you didn't do over the period of time was write your dissertation. I mean,
Yes, my dissertation was in the trunk of my car. I would look at it every weekend. I would open the trunk and say, hello, dissertation. I'm going to get to you next week. I did that for months and months and months, but I never finished it.
So Mario's term was over, and what happens next?
I was very fortunate.
You had a couple of opportunities.
I had quite a number.
Europe and other.
Yes, I had a number of opportunities. I almost ended up in Europe, but Empire Blue Cross Blue Shield reached out to me. Mike Stocker, who is still a very prominent person here in New York, he reached out to me and asked me to join the Empire team, which I did. It allowed me to keep my family in Albany for a while, so ease the transition. So I was able to work in Albany a couple of days a week and work in New York City a couple of days a week, because I was living in Albany at this time. And I stayed there for a period of time, probably 8-9 months. It wasn't for me.
So what happens? You get a phone call?
I got North Shore at the time. I did not know the people at North Shore
That was
well.
Gallagher at that time.
Jack Gallagher. I had met Jack Gallagher a couple of times as my role in the governor's office when I was overseeing a lot of the healthcare issues. But I didn't know him that well. But he had a person reach out to me asking if I was interested in talking to them. And I said yes.
And this is before, just at the beginning, before the mergers of hospitals took place. 95 was getting close, right?
Well, but a couple of hospitals had merged. A couple of hospitals had legally merged.
Presbyterian was...
Well, in our health system, in North Shore, Glen Cove and North Shore had merged at that point. The other hospitals in the region here, there was a lot of,
There was talk.
There was a lot of talk.
Right.
I've often termed it the hospital dating game. Every hospital was dating everybody else because there was a lot of turbulence.
So when you joined North Shore, and you said there was the Glen Cove, you had a system with probably $2 billion in revenues.
Yeah, it wasn't even that much at that point, about $1.5 billion.
And how many beds at
At the time, probably about 1,500 beds. And then 95, 96, 97 was the major integration effort for all of the hospitals.
So how did the North Shore system, who had a nice hospital, and then the LIJ system, North Shore was in Long Island. Yeah. LIJ was literally Long Island, but they were Queens. Maybe a quarter of a mile into Long Island. How'd that how'd that dating game start?
Well, North Shore, as you know, had expanded, and we were adding all of these other hospitals, and LIJ at the time, at one time, thought it was going to stay by itself. Then it actually tried to merge with Beth Israel. That didn't work out. And then a number of board members on the North Shore side and the LIJ side who knew each other pretty well. And Saul Katz was one of the main drivers of this. Saul Katz, I remember raising the issue, well, why not LIJ? We should talk to LIJ. Now, back then, those two hospitals, their relationship was not positive.
They were arch enemies, we would say.
Yes, they did not like each other at all, and there was, even though during that whole history, from what I understand, they didn't really do much together. Now they're separated by 2 highways, the Northern State and the LA area in between. So now LIJ was looking south, North Shore was looking north. But Saul Katz, with a couple of board members from LIJ, basically said, well, why not? We should talk. It broke the ice. Nobody.
Now, LIJ had a hospital and a children's hospital.
It was all one complex. It had the acute care hospital, it had a children's hospital as part of the main hospital, and it had a psychiatric hospital. And so after a number of discussions back and forth, we decided that we would have a staff meeting where we would put the key players from either side together to see whether or not we could get along. And we met. Everything seemed to go okay. Some of us didn't have any historical baggage. So, the past, whatever happened in the past, let's move forward, was the attitude. And there was a decision
But
made.
you had 2 operating heads, okay?
Then it took 2 years to get to 2 places together.
And you also had the FTC, right?
And we had to go through the Justice Department, and they took us to court. There was a challenge, the merger.
Under what basis?
On the assumption that if the 2 hospitals came together, that it would be too strong a player in the region. And they tried to make that argument. There was a 2-week court trial, and we won. And in October of '97, North Shore and LIJ officially, legally merged.
Now, as you were saying, the dating game, there was the dating game of New York Presbyterian, who had a marriage, and then there was the dating game which did not work,
Right.
of NYU and Mount Sinai.
Mount Sinai.
And then there were a number of dating games in New Jersey.
And at one time, North Shore and New York Hospital were talking. As I said, LIJ and Beth Israel were talking. And you had the Sinai NYU. And of course, today, it continues. Today, you have Mount Sinai and Continuum talking. Continuum being Roosevelt, St. Luke's, and Beth Israel. They're now talking about possibly coming together.
So it's '97. At that time, you're the senior executive, you're the senior vice president in charge of a hospital.
And then I became chief operating officer.
That's in 2000.
That was about, I think that was about '98.
And your job as chief operating officer was literally to take the merger.
It was to try, part of it was in many ways, is try to get all of these various constituencies from the various hospitals, especially North Shore and LIJ, to try to work together and then figure out how to consolidate services, consolidate back office functions, how to make it work as a system rather than a collection of individual entities separate and distinct from one another.
Now, that's the interesting thing. And, a lot of people, when they hear of the North Shore LIJ, they think that you are like the New York Presbyterian health system, which is a loose affiliation. You own these hospitals, right?
Yes, we own all of the hospitals. Yes, it's an ownership model where there is single leadership, single clinical leadership and administrative leadership. There is single board. Now, there is a board of every hospital, but they're all the same people. So essentially, there is one board. It's a mirror, what's known as a mirror board concept. And it was all, was to make sure that the standards and the protocols and the procedures and the metrics are all standardized across all the facilities.
It's 2002, and you're made president and CEO
Right.
of the system. What's the size of the system at that time?
At that time, we were about 4 billion, I would say, little less than 4 billion.
And at that time, you had you had left, besides being in Queens because of the LIJ, you and always the prominent side in Nassau County,
Right.
over there. You had gone into, you were already in Staten Island.
We were in Suffolk, Nassau, Queens, and Staten Island, and we were, the biggest player in the New York area.
Now, what happens? How do you? Because there are some major situations. I mean, over the period of time, how much building have you done? You've rebuilt hospitals and you've rebuilt campuses and everything.
Well, there's been a substantial amount of investment because and this is something that's common in the whole New York area, most of these hospitals were built in the 1920s and 30s. LIJ and North Shore were built in the late 40s. And some of the facilities had not been kept up at all. No, the maintenance was neglected. The new construction that needed to be done was not done. And if you're going to have long-term sustainability and you want to be around 10 years from now, you've got to have your facilities in pretty good shape. So it required a lot of allocation of resources. So yes, we have built and upgraded and expanded a lot of our facilities. The biggest one is LIJ. LIJ, and I was there, this morning. LIJ has been completely rebuilt. To go into LIJ today is you will not even recognize the campus.
You renovated or knocked down?
Both. Renovated and built new. A whole new patient tower in front, which is absolutely spectacular. It has a women's hospital in it. It has, med-surg beds in it. We built new emergency department, new critical care, new speech and hearing, new garage. We're currently building a whole new addition to the children's hospital. And in 3 or 4 months, we'll open up a new psychiatric hospital. So the whole complex is the newest in the region right now.
Now, how do you decide that, I realize you were working on Circle Line, you had Manhattan over here. How did you decide to go after a troubled hospital like Lenox Hill?
Well,
I know you like challenges.
Yes, challenge, like without challenge, life is boring. Without challenge, it is really boring. You have to stretch yourself all the time, and organizations have to stretch. You just got to pull it tight because you will always have a lot more capability than you think you have. It was important to have a Manhattan presence because if you just look at it from the pure politics and the marketing and the branding, if you're not in Manhattan, you're not treated the same.
You're still a stepchild.
You're still someplace, you're out there. It's the media hub, it's the communication hub, etc. But also, we were very involved in Queens. And 60% of the patients who come to Lenox Hill come from outside Manhattan. Huge number of them from Queens. So in many ways, a lot of patients in Queens will come into Lenox Hill and other hospitals, of course, in the city. But the subway, because there is a subway right at the base of Lenox Hill Hospital, it made travel to Lenox Hill a lot easier. And quite honestly, it was right smack in the middle of a lot of the other players here. And everybody basically indicated that there is no way you can make this successful. And that in itself is a fabulous motivation. Plus,
but you've always liked challenges. I mean,
But plus the hospital has a wonderful brand and a wonderful legacy, a famous place.
Going back in the 1860s or something?
1850s,
Right.
yeah.
Now, something you also like doing is you like changing. You don't like consultants. You like changing management, right?
Well,
Stir the pot, would we call it?
Well, you should never, when you take a person out of a role, it's something you should never really like to do because you're disrupting somebody's life and you're disrupting the family situation. So I wouldn't say that I like it. I recognize that it has to be done. If you want to go forward, you can't do it with people who spend most of their time looking in the rearview mirror. You have to have people who are willing. Leadership is about promoting change, not being overly risk averse, having a can-do attitude, positive, optimistic attitude. You don't necessarily have to have all the technical know-how because you can get those people around you, but you got to lead. Lead is being able to have people behind you follow you.
So let's talk about leading because it's very interesting that, look, you had your affiliations with NYU, you had your affiliations with Einstein, you still maintain them, and then you I believe it happened a couple of years ago when you created the MBA program with Hofstra, with the Zarb School.
Yes, right.
That was the idea. How did you decide to start the first new medical school in 40 years?
Well,
in New York State.
A little bit, just a second on the context. As part of the North Shore-LIJ health system, we have a unbelievably advanced in-house university system, I would call it. We have what's known as a Center for Learning, which is probably one of the most robust and one of the most advanced of any health system in the United States. So I'm very big into creating a culture of learning and very big into education, because if you don't continue to educate the people and provide opportunity for upward mobility, you're going to stagnate. And we had done, as a part of this, we had done these programs with Hofstra and with other universities. And then there was a moratorium on building any new medical schools. For years and decades, you couldn't open a new medical school. Then the people in the know realized that you had to allow new medical schools to open up to create doctors for the future. When that moratorium was lifted, I had breakfast with the head of Stuart Rabinowitz, the head of Hofstra University, one morning, and we talked about the possibility of why not a medical school? And it was as simple as a conversation, just like this. So what about it? Well, maybe we should. Okay, let's talk about it. And I had previously hired a person named Dr. Larry Smith
From Mount Sinai.
from Mount Sinai, who is, his sweet spot is education, medical education. A very dynamic individual, very, very innovative in this area. So the following week, I asked Dr. Smith to come to the meeting with Stuart Rabinowitz and I. And right there we said, let's go for it. And then we went back to our respective boards. And they eventually said yes. And from the time of that original meeting to the time that we got a final approval was just about 3 years.
And your first class was September of 2011.
Summer of 2011, the first class has
40,
finished.
40, and the second class right now is 60. But,
60.
But
And by the way, we got for this class of 60, we got 5,800 applications.
now, one of the very interesting things that you do with that is that during their first 9 weeks of school, you put them, they EMT training, right?
Well, the curriculum is different because it's based on the concept that you learn by doing. And you want people connected to patients and the customers right from
As
day one.
opposed to medical school normally where they go the third year, where they finally meet a patient.
Yeah.
Here, what do? You have
do it
the
right
EMT training and you...
Yeah, they're all trained as EMTs in the first 9 weeks. Right away, they'll ride out ambulances and they get to deal with patients directly and observe other people dealing with patients, and they get to follow those patients. And in the first year students, all of them have been in the operating room assisting on surgery. All of them have done diagnostics on patients. Obviously, when we're so big as a healthcare system, we can provide all of the coaching and the mentoring that's necessary.
Now, this is owned 50% by Hofstra and
50% by us, right? All the training, the faculty around, 95% of the faculty are on the payroll of the health system. And by the way, the physicians in the health system are absolutely enthralled by this. They love this idea. And we have our own research center, and that's combination with the research that goes on at Hofstra. It's a wonderful synergistic relationship, and it works very, very, very well.
Now, in addition to that, you have an involvement with General Electric on one program, and you have an involvement with our mutual friend Steve Safer at Montefiore and Cleveland Clinic. Let's talk about those things.
We have a relationship with Montefiore. Montefiore is a wonderful organization that deserves an extensive amount of credit for all of the great things they've done. And Steve is a wonderful guy. And so we developed a relationship with them about 2 years ago, where two organizations in two different markets, essentially, where we can work together to share best practices, learn from one another, push one another to raise the bar, do things together where it is important to do so. And so we currently have about 10 to 12 projects going on between us and Montefiore. And we learn from them. They do great things. They learn from us. They participate in some of our work. We participate in their work. Our doctors work together. And then we have a relationship with Cleveland Clinic, where they have an innovation center that is absolutely a wonderful resource in helping to identify and commercialize intellectual resources that you have, like all of the patents that we have in our research center, where you have this wonderful idea, you have this new development, and you want to take it from not only concept, but proven concept, you want to take it to business, to become a business. And they do know how to do this, so we have that partnership. We also have a partnership with Hackensack, University in New Jersey, where we are also doing a lot of work together.
And GE?
But GE, we had a large relationship with GE years ago, as I brought a lot of GE in to help us in things like Six Sigma, Lean, all of those techniques that you use for efficiency and productivity. And recently I just did a special relation with GE and Jeff Immelt, and I held a press conference where we are replacing all of our CT scans
With low
dose, so that you can, a patient doesn't have to worry about getting a CT scan and getting unnecessary radiation.
St. Vincent's, what are you doing over there?
At St. Vincent's, we're opening up across the street from St. Vincent's a major ambulatory care center, which will have a full comprehensive emergency department, full imaging services, ambulatory surgery, a wellness center, and physicians' offices. It'll be 160,000 square feet.
Is this going to be called North Shore-LIJ, or is this going to be called Lenox Hill?
Well, it'll be tied in with Lenox Hill,
Because
but obviously we'll have the North Shore-LIJ name up there as well. As and this is across in the O'Toole building, diagonally across from St. Vincent's, right in that wonderful area there. So,
with about 2 minutes left, there are a couple of things we have to talk about. You were saying you have about 130 people on the big board, but really, in a way, you have a kitchen cabinet, right? You have like 24 executive committee, but there's an
executive committee, and obviously there, like in any organization, there are a number of people that I deal with on an ongoing, regular basis. Board members that some have been around a long time, most have been around a long time, who are obviously very interested in the overall strategy, very interested in where we're going. I spend a lot of time thinking about where you need to be 10 years from now, because you manage for the present, you lead for the long run, and you want to build long-term sustainability, and you want to leave behind a legacy that other people can make better. And that's basically the challenge for all people in any leadership position. And also, not to be reticent about shaking things up a little bit and pushing the edges of the envelope.
Every week on Monday, you meet with all new employees.
Yes.
For 2.5 hours,
yes.
right? What do you do?
I've been doing this every Monday for 10 years. I talk about a little bit of the history of the organization, because it's important for all of these employees to know. And I meet with employees at every level of the organization, no exceptions. I talk to them about the business imperatives, what we have to be good at and their role in it. And I talk about what's most important in my view, values, behaviors, responsibilities, obligations, and their role in all of this.
Next generation of Dowlings. Talk about your children.
I have two wonderful children. A son, Brian, who is a radiologic technologist, works at North Shore LIJ Health System, does MRIs and CT scans, etc. And I have a daughter who a year ago became a nurse, Elizabeth.
Is she working at North Shore?
She works at North Shore on the night shift. She's actually works this week, I think, 4 nights, which she enjoys. She's on the oncology floor. A little bit upset that it upsets her social life, but that's, people have to go through the hurdles. And then my wife, Kathy, is has been the person who allows me to do all of this. She takes care of everything else. I just work.
You just work. So I think the work ethic, what you got from your mother and your dad, has really proven, and you've been a great individual, and I'm so happy I've been able to have you on my show and tell your life story.
I'm delighted to be here, but I've been very fortunate. I've been helped along the way by a lot of people, a lot of mentors, a lot of coaches, a lot of people who've helped not even knowing that they've helped, because let's be honest, we take an awful lot of credit ourselves for what we accomplish, but an awful lot of people have helped along the way as well.
Thank you very much for being here.
I thank you very much, Michael.